Thank you and welcome to this afternoon's webinar on meeting the needs of justice-impacted youth. My name is Mary Ellen Mathis with Health Management Associates. And to kick off, here is HealthNet's family of brands: California Health and Wellness, Am Better from Anthem, WellCare by HealthNet. I'm sorry, Am Better from HealthNet, WellCare by HealthNet, and WellCare. In addition, health plans that HealthNet supports include CalViva Health. A few housekeeping items for today. As an FYI, this webinar is being recorded and attendance is being tracked via login. However, if you do have any technical issues today, please feel free to message me, your host, with any difficulties that you may be experiencing. And then after the webinar today, you will receive a copy of today's PowerPoint slide deck and a recording link. As a friendly reminder, all participants are automatically muted, so we do encourage you to use the chat function today. And then if you do have any questions that we aren't able to address, we're happy to address them in an upcoming forum. For today's agenda, we'd like to kick off with some brief introductions and welcome, and then we'll quickly go over the learning objectives.
Hey, Marilyn, should I start?
Yeah. Go for it, Julie.
I'm going to start. So welcome, everybody. Thank you for joining us this afternoon. John and I are really happy to be here today. Our agenda, we're going to do welcome and introductions. John's going to introduce himself, then I'll introduce myself. We're going to get into the learning objectives. We're going to talk about the current landscape of juvenile justice in California, the unique health needs of justice-involved youth. We're going to talk about justice-involved youth terminology and how that differs from adults in the criminal justice system. We're going to talk about the sequential intercept model and the CalAIM justice-involved benefits and how to engage justice-involved youth. And then we're going to leave it open for questions. John, do you want to get us started and introduce? Oh, I'm sorry, Nancy. We'll start with you.
Hi,
Nancy, do you want to introduce yourself?
Of course. Thank you, Julie. Good afternoon, everyone. Welcome to our CalAIM Provider Training Series. I'm Nancy Wong-Vipad-Kalev, Senior Director of Systems of Care with HealthNet. So this is a part of a series of justice-involved provider trainings that we at HealthNet, CalViva Health, and California Health and Wellness are hosting in partnership with Health Management Associates. We're thrilled to partner with today's speakers who are experts in the justice-involved system, Julie White and John Rubin. John and Julie will help us look at best practices and approaches for meeting the needs of justice-impacted youth. We recognize the important role that you all play as providers and potential providers, and thank you for helping us implement this very important program across the state of California. We also welcome your feedback, as always, and encourage your active participation in today's webinar. Thank you. With that, I will turn it back to you, Julie.
Thank you so much. John, do you want to introduce yourself?
I'm ready. So,
Okay.
Hi, everyone. I am John Rubin. I'm a principal with Health Management Associates out of the Philadelphia office. My very quick background is I am a social worker. I spent most of my career working in child welfare and worked my way up in Bucks County, Pennsylvania, just outside of Philadelphia, to where I was Director of Housing and Human Services for 5 years for Bucks County, overseeing child welfare, juvenile justice, drug and alcohol, Medicaid, contract housing, all the mental health work, all the various pieces of the housing and human services system before being appointed by Pennsylvania's Governor Wolf as the Deputy Secretary for Children, Youth, and Families for the state of Pennsylvania. So I oversaw child welfare and juvenile justice for 3 years for Pennsylvania prior to joining HMA. And appreciate really very much the opportunity to speak with you today and look forward to today's presentation and also hopefully some discussion. With that, I'll turn it back over to Julie.
Thanks, John. And I'm Julie White. I'm also a social worker, and I am a principal with HMA in our Boston office. I've spent update my bio, 30 years working in the justice system. And I started off working with the juveniles, and then working in diversion programs, and then worked most of my career with adults overseeing comprehensive healthcare programs in jails, prisons, and in Federal Bureau of Prison sites as well. My time now is primarily spent working in California on the justice impacted aspect of CalAIM and the demonstration, the 1115 demonstration, and working with other states that are looking to implement something similar in their states. So thank you again for joining. We'll get right into our learning objectives for today. So I'm hopeful that by the end of this training, you all will understand or better understand the juvenile justice landscape currently in California specifically, and understand the unique needs of juveniles in correctional settings. We're going to talk about effective and evidence-based state models for justice-involved youth, and that will be tailored specifically to California. And we're hoping that you will learn how to create a whole person approach to health needs of juveniles in the justice setting or coming or transitioning out of justice settings, and also understand the roles of schools in the community in addressing the needs of justice impacted youth. To kick us off, we have a couple of slides that are polls that is going to help us better understand who's in our audience today. So Mary Ellen, can we bring up those polls? The first one is asking you all to respond about what ECM services do you provide, and there's a long list and a second question, so just make sure that you're scrolling down. The second question is, what community support services do you provide? Actually, there's a third question. And the third question is, please choose your population of focus. We'll give this just another minute. Looks like we still have responses coming in.
And I was going to compliment the group that they are getting it and answering questions. So we appreciate your participation. We do want this to be interactive. We do want to have this be conversational for you as much as possible.
And we do understand, thank you, Janet, that some folks are in the audience who are not ECM providers. So. Mary Ellen, you want to give it 30 more seconds?
That works.
All right. We're getting there.
All right, looks like we have about 55% participation. I will go ahead and close out the poll and launch the results. As far as ECM services, currently provided looks like 78% enhanced coordination of care, 69% outreach and engagement, 47% coordination of and referral to community and social support services. Question number 2, which CS services do you provide? 72%. Housing transition navigation services, housing deposits, housing tenancy and sustaining services. Question 3 looks like 89% population focus, adults, families, children experiencing homelessness. And question 4, indicate the MCP that you were a provider for, looks like 42% health net, 56% other.
Great. That's really helpful for us to see who's in the audience and the populations you're serving. And we have one more poll to see, and you can put, are we going to have them put this in the chat? Oh, no, that there's a poll questions. Do you currently serve justice impacted youth in your practice? Is the first question. And then the second question is, if you do serve this population in your practice, do you ask youth about their involvement in the justice system during screening? Right, Marianne, I think we can close this out. I know we only got 45%, but it looks like people stopped.
Looks like about 56% are not currently serving justice impacted youth. And do you currently ask youth about their involvement in the justice system during screening? 66 currently say no.
It's really helpful. So thank you all for participating in this. And so, I think the important thing to point out is there's, a decent percentage of you all that don't know if you're serving this population, and that's very common for providers who are working with adults as well. And sometimes there's some stigma or concerns about working with individuals who've been involved in the justice system. But at the end of the day, anybody could walk through the practice and we don't know exactly all of their history. And so we're hopeful that by walking through this training with us today, you'll have a better sense of the needs of this youth. And then I want to go back to the question I think there was 4 providers or 4 folks that said they do ask about this in their screening. And I'd love to just open up the conversation here briefly to ask, specifically what question do you ask on the screening and how is that question received? So if anybody wants to brave it and come off mute or add something in the chat, we'd love to hear about that question. Great. Okay, so you ask if you have a probation officer supporting them. And did you mind me asking what type of provider you are? And then you ask the 2 follow-up questions. ECF. Okay. Great. That's helpful. Anybody else ask this in a different way? Well, we know it's helpful to know the past of the folks that you're working with. But we also know that this can be a question that could, people could shut down when you answer. So one suggestion that we have, going into this is, if you are considering adding this to a screening tool, you might want to ask about alternative places where they've received medical or mental health behavioral care, such as in a residential or institutional setting. And that way you're not coming right out and saying, have you been arrested? Are you involved in the criminal justice system? Or you currently have, probation or parole? But you're asking if they've received care, because this really is about not so much their justice involvement, but more so where they received care in the past. And hopefully that will help enlighten you to some of the things that, they might be experiencing because of their past involved in the justice system. All right, so we're gonna get moving along here. Thank you guys for participating in the polls. And I did see that it was a little wonky for some folks, they couldn't submit, but thank you for participating. So we're going to talk about California and the landscape for juvenile justice, which has changed pretty dramatically over the past several years. And Mary Ellen, if you want to advance the slide, after June 30th of 2021, youth are no longer committed to the Division of Juvenile Justice, except for rare court appearances. All of the DJJ facilities were closed as of June 30th of this year, with the exception of the Pine Grove Youth Conservation Camp. And that remains open to serve youth. So currently, youth have been moved back to their counties, and they are being served in county facilities that are overseen by probation. All state juvenile operations ceased in June 30th of 2023. And so what we're seeing is they're back in the communities at a local level, and that's very intentional, focused on keeping them close to their communities when possible, and keeping them close to their families or key important people in their lives. And it also helps, obviously, with transitional planning and helping to work with providers prior to release and then upon transition out of these facilities. Next slide, please. Like I said, probation agencies oversee the county juvenile justice systems around the state, and we've seen, it's really these systems depopulated. A lot of people, juveniles kept now in community, maybe on supervised release. So we're seeing fewer numbers in custody, but those who are in custody are in their counties. And again, this is part of a long-term reform effort, knowing from research and data that youth do better when they are closer to home, and they do better in settings that are less institutional and more home-like. So usually these are run in like group homes that have secure settings, and then some are actual lockup settings. Next slide, please. The big picture with juvenile justice, the overall goal is to improve public safety. And in order to do that, we really have to find practical, proven responses in working with youth. We know that the responses that we provide in the adult criminal justice system are not appropriate for youth for a variety of different reasons. And we want to have good outcomes. And one of those good outcomes is that they're healthy when they come out of these systems, that they're engaged in the care they need and the supports they need, and that they're not institutionalized. And really want to break that cycle of offending. And, the research has shown if you keep them close to the communities, keep them close to their families or important adults in their life, and you're providing them whole person treatment, behavioral health, physical health, and services that address their social determinants of health, you can help to stop that cycle of offending. Next slide, please. Community-based programs that involve families, again, I can't stress this enough. I know I keep saying it. It's a critical component of juvenile justice and it enhances outcomes, increases public safety. And anytime we're able to do that, we're strengthening neighborhoods and communities that we all live in. State-run facilities, the ones that were really just closed down, are the most expensive facilities to run. And we see this throughout the country, not just in California. These are really institutional settings. They're expensive to run from a staffing perspective, from utilities perspective, from grounds and maintenance, capital expenses. And the unfortunate part is that we don't see great outcomes from youth who have been held in these institutionalized settings. What we have seen is data coming in supporting that they do better in home-like settings in their own communities. These large institutional settings are not well equipped just by their design alone, oftentimes to deal with trauma and the mental health needs of the justice-involved folks. And we really want to keep them in their community so you can start to make those connections with you all prior to release, establish a rapport, and make sure there's a warm handoff as they're transitioning back into the community. And when kids were being kept far away from home, it was really hard to be able to do that and do it well. Next slide, please. So the unique health needs of justice-involved youth. Next slide. They are obviously a vulnerable group, and social determinants and health-related social needs have played a major role and oftentimes had a detrimental impact on their growing up and impacted their involvement in the justice system. Oftentimes when interview youth who have been detained and you do a psychosocial intake or screening, you'll find that they report, food insecurity, unstable housing, lack of access to quality education, safe education in a safe setting, economic opportunities and jobs. Oftentimes they come from family units that may not be intact or secure, community environments that may be rife with criminal activities and violence. They often report they don't have good access to recreational facilities and transportation, and this is often a barrier in and of itself to be able to access jobs, other parts of the community, healthcare appointments, etc. And we know that community-based social and healthcare services are really crucial in how and why many of these youth become involved in the criminal justice system. So there's an opportunity for youth detained. There's no simple solutions, but what we can do is expect more from the systems and the adults and trust it with the care of this population during detention. And this is a ripe opportunity for providers that are working in these juvenile facilities, and oftentimes they have contracts with healthcare providers to do screenings. We know that there are higher rates of STIs, sexually transmitted diseases, HIV/AIDS, higher rates of mental health issues, suicidality, substance abuse, and developmental health conditions, and also inadequate childhood vaccination. So when they are being held in these facilities in their communities, it really is an important opportunity for the providers there to make sure that they are screening thoroughly for all physical and behavioral health issues, including substance abuse, and also making sure that they get timely, respectful care that's adolescent friendly and trauma informed. And we're going to talk about that a little bit more in coming slides. So although this is an undesirable time and, we don't like to see youth being detained, it is an opportunity to intervene with good healthcare and behavioral healthcare practices. And it sounds like somebody came off of mute, so I just want to pause to see if we have any questions or comments before I go further. And you can also put stuff in chat if you like. Okay, Mary Ellen, we can keep going, but if folks have questions, please feel free, just put them in chat. So there was a pilot with the whole person care in Los Angeles that looked at 83 youth in their juvenile justice system, and it had some really interesting findings, some of which are not completely surprising, but I think the one point I want to focus on at the end is their resiliency. But through the whole person care pilot in Los Angeles, 83 youth were interviewed, and on average they were 16 years old. Majority of them were male, and they were all from racial or ethnic minority groups. This group had really high behavioral health needs. And this is important to know when you're doing screenings, and John's going to talk more about the need for whole person care. High prevalence of prior suicide attempts that need to be explored, and safety plans need to be in place, and a history of substance abuse. And you look at that, 81% of the youth report having histories of substance use. And this is something that also has to be addressed both while they're in care and custody in the county facilities, but as they transition back into the community as well. Many of the participants reported a pattern of crisis healthcare utilization, meaning that they weren't regularly seeing primary care or a therapist ongoing, and it was really they were seeking crisis services. I think the most important thing I said earlier and want to call out again is that the majority of these youth desired vocational training. They wanted training so that when they got out, they could be productive members of the community. And almost all of them wanted to return to school after release. And again, this just really points out their resiliency and their intention to really want to rejoin the community as productive citizens. So again, it's really stressing this is a key time in their lives where interventions can work and really stop a course from further offending. Next slide, please. We know that many youth served in juvenile justice have significant healthcare needs. When we look at the data, we see high rates of TB, dental problems. Oftentimes we see that dental problems have gone unaddressed for years at a time. And sometimes, you know, in my experience in overseeing healthcare for dental facilities, states are not always willing to pay for ongoing dental care. They'll pay for cleanings and that's it. But if young adults have orthodontic needs, they're oftentimes not being addressed or being addressed appropriately. And when we think about, you know, kids this age, many of them have orthodontic needs. We see higher rates of sexually transmitted infections, including HIV. 2/3 of youth have a diagnosable mental health or substance use disorder. And when we look at the national data, this isn't specific to just California, we see that fewer than half of the youth detention facilities provide mental health evaluations to all youth. And that means everybody that's coming in their system. About half of the youth in custody say they've personally met with a counselor during their stay at a facility. And so, you know, we know that there's a much bigger need, and really 100% of the youth that are detained in these youth facilities could benefit from working with behavioral health clinician. So I see we got one question. Does having a record affect their job prospects, since vocational training is common with that population? So that's a great question. And oftentimes for youth records, employers cannot see that. There's also ways that they can get their records expunged. Usually employers can see adult records, and it's not visible to employers if somebody has a juvenile record, but that is a great question. And we do see as they get older, having a record may affect their ability to get certain types of employment. And Marianne asked, what about getting resources for parents, getting parenting classes of giving the right support system specifically for parents, guardians, and children in custody? That's another great question. Any way that we can support, and maybe John, you'll talk about that when you talk about the whole person needs. support really the environment and the ecosystem in which they're living, including their family units, is going to be helpful for the youth and the families themselves. And I know John's going to talk about that a little bit more.
Yeah, that's definitely something we'll want to highlight, that the youth can only, if they're going back to their environment that they've been living in, they've stayed in the community, as you highlighted earlier, Julie. Sometimes you have to do whole family care, multi-generational supports, and the role of the provider in connecting families to the resources in the community is important.
Yeah.
We will talk about that.
Great. And then Andy has a question. You may have a plan, but it'd be helpful to know what mental health measures are conducted in the juvenile justice system.
If I could make a quick call, and then when I...
Oh, can everybody mute themselves? To know what records to request when we are helping with their transition to the community. Yeah, this is actually a core component of what, California's calling Path 3 for the carceral settings and for the transition into the community. So the juvenile systems should be doing a screening and intake, asking about previous care, and they should be soliciting records. And I think you'll see some probably inconsistency depending on the counties in which you are working and supporting. But it is a very fair question as you start to work with the juvenile facilities to see what records they already have got and who they got them from, because it is going to be really a core component of aftercare to ensure that you have a full picture of both their health records from their time while they were detained and also any care that they were provided before that. And then I see Mary Bell has a raised hand.
Julie, I just wanted to touch base, and this is Maribel Navarro with Madera County. If for employment, for justice involved youth, if they're looking for vocational training or employment services, they can always access the local workforce development board agencies through Department of Labor. They do have a strong emphasis in trying to target a lot of the youth for the vocational trade systems. So I know in California, we have like Youth Build or AmeriCorps or Job Corps. Those are all linkages of agencies with employment and educational services targeting vocational trades. So that could be a useful resource tool for anyone looking for employment services for youth. I know there's a lot of funding coming down the pipeline from the state, connecting youth back to the workforce. And this is a great segue or a great way to connect them if you just access your local workforce development boards.
Yeah, thank you so much for putting that up. That's an incredible resource. And it kind of ties back to that previous slide where we know the majority of these youth want vocational training and they do want to be productive members of the community. So I really appreciate you adding that. All right, I think I cleared all of the questions. So I'll kind of keep going with this, but again, feel free to jump in. I think what's really important when you're working with youth is that more than 80% of juvenile justice involved youth report exposure to at least one traumatic event. And oftentimes when you work with the youth, you know that they've been exposed to multiple pervasive and chronic traumatic events throughout their lives and multiple forms of victimization. And this is really going to play out in how you approach the youth, the words you use, the language you use, the environment that you have in your office, the training that you provide to everybody in your office. I think John's going to talk a little bit more about that as well. It's really important for everybody who is working with these youth and interacting with them to understand the impact of trauma and know that really it's more often than not that these youth have experienced really traumatic events, and being detained in custody in and of itself can be a very traumatic event for many youth. And so it's just really important to approach things and make sure people have appropriate training around trauma-informed care and how they communicate with folks and understanding sometimes resistance or shutting down, not answering questions, not wanting to disrobe for an exam, etc. All of these could be trauma-related responses, and it's important for everybody to really understand that and really be able to use some motivational interviewing skills to talk to the youth and be careful of the words they're using, because you don't really want them to shut down any further. And I know John will talk about that a bit more. Next slide, please. It's also an important reminder for all of us, why do we treat youth different from adults? Well, there's a variety of reasons, but I think the most important reason, based in science, is their brains aren't fully developed yet. And, we know this now. We know this from imaging technology and research that, that part of their brain that develops last, that cortical brain, the thinking, learning, language, and inhibiting, oftentimes is not fully developed until youth are really in their early to mid 20s. And this is important because this is like the breaks. Youth have a lot going on with hormones and everything else, and trying to make decisions. And oftentimes they just don't possess the breaks that hopefully we as adults will have. This last part of the brain is not fully developed. And oftentimes, they're not making the best decisions, and they may be uninhibited. And so it's important for us to keep that in mind when we're working with them and our expectations for them. And I think I saw another question come up from Lisa, wondering if any agencies on the webinar are doing ACEs screenings as part of their youth assessment. Yeah, so if folks are doing ACEs screenings, it would be great to hear from you, and you can just put that in chat as well. Terminology for youth involved in the justice system is different than the terminology we use for adults. And so, Mary Ellen, if you could forward that. This is important because folks who work in the juvenile justice system, they'll get real finicky about this. So you want to watch the language you use. In the adult criminal justice system, we would say, there's a charge or a complaint against somebody. In the youth criminal justice system, a petition is filed. So we don't use that term complaint. We don't use that term charge. In the adult system, if a decision's been made and somebody's been found guilty of a crime, we say they've been convicted or there's been a conviction. For youth, we use the term adjudication or an adjudicated juvenile. And then for adults, when they receive a sentence, and a sentence could be that they need to serve jail time, they need to serve prison time. A sentence could be that they have to be on probation. A sentence could be they have to do community service or pay a fine. Those are examples of sentences. We don't use that term sentence, however, with youth. We use the term disposition. And that's just something you might want to write down and just keep in mind, particularly if you start partnering with criminal justice agencies and probation agencies that are serving youth throughout California. We're going to talk a little bit about the sequential intercept model and then the CalAIM justice involved benefit and the parameters. So this is a model that many of us who work in the justice space use. It's called the sequential intercept model. If folks are familiar with it, please, let us know. That's great. But you can see there's 5 intercepts, and ideally we wouldn't want to be starting with this red circle around intercept 4, intercept 5. We really would like to start the conversation here at intercept 0. What kind of community services are in place in their care continuum, and ideally maybe even pushing it back to -1 if there's such a thing. Using primary care, using behavioral health to address issues in the community and prevention, and then using crisis appropriately to deflect and keep people out of the spider web, really, that is the criminal justice system. And I say this because once folks are involved in the criminal justice system, it's often very difficult to become untangled from that. But here we are with the CalAIM initiative, and we're talking about reentry, which is intercept 4. And that includes reentry from prison for the adults and jail for the adults and the juvenile facilities for youth. And intercept 5, which is community corrections. So folks who are on parole, juveniles who are on parole, or probation in the community. And this is the opportunity where many of you are going to get to work with youth. We hope that you're able to work with youth, again, back on the other side of this sequential intercept model. But we know with CalAIM, you're going to have an enhanced role in Intercept 4 and Intercept 5, and helping to develop rapport with the youth, possibly doing intakes before they're released or having meetings with them before they're released, and continuing the care once they get into the community. Any questions about the sequential intercept model? All right. We'll move on to the next slide. Just going back to sequential intercept model and 3 primary domains of trauma-informed care. When we're talking about the reentry and community services, you want to make sure at a clinical level, your screening, your assessment tools, your interventions are all trauma-informed, and that your staff has had training around this and understand the impacts of trauma and some reactions that could be trauma-related. Again, taking that even wider to an agency context. So making sure this is part of your workforce development and your support, making sure it's part of initial training when people start with you, and ongoing training, and really promoting a safe environment throughout your agency, wherever services are being provided. And then a system level, making sure policies and procedures and cross-system collaboration takes into account the needs of youth who have experienced oftentimes prolonged trauma and chronic trauma in their lives. So key CalAIM parameters for the justice-involved population that we want you to keep in mind. This offers an unprecedented opportunity to provide pre-release services to individuals for the adults who are in jails and prison, but particularly for purposes of this training, for youth in detention facilities up to 90 days prior to release. Now, this doesn't exactly mean that jails or probation departments are going to open their doors and say, come on in, but it is an opportunity to partner with your counties and these facilities and establish what they think would be a best practice regarding developing a rapport, being able to do assessment and screening before they get out, and developing really solid care management plans for both physical and behavioral health as they transition to the community. And this may be done in person, it may be done via telehealth. It's all going to depend on the county in which you're working. But the important thing is now that these are billable services. So while reentry is not new, and people have been doing reentry work for many years now, oftentimes it was patched together with grant funds or maybe a state line item funds. And now it's an opportunity for providers to bill Medicaid for these services. And this is really seen, the administration, Biden administration, the California administration really sees this as a health equity issue. Many of these youth who are detained, if they were not detained, would be receiving Medicaid services, and making sure that it's equitable for youth who are detained, as well as youth in the community, that they're receiving equitable care and quality care. Targeted pre-release package includes at a minimum the case management, physical and behavioral health services for those transitions of care. Medication assisted treatment is covered under this benefit and encouraged. We don't see a lot of that going on right now in the youth facilities, but given the fact that in California, youth can be held up to the age of 25, it would be completely appropriate for youth with opioid use disorder to begin medicated assisted treatment, or alcohol use disorder. Also, they can leave with durable medical equipment. This is new, and that can be billed towards Medicaid. And everybody has to leave now with a 30-day supply of prescription drugs. And again, the aim of these pre-release services and the engagement with providers prior to release is to identify both their health needs, behavioral health needs, and any health-related social needs. I'm going to do implementation planning, Andy, then I'll come back to your question. So the implementation plan includes increasing coverage. So we expect that there will be more people covered through this initiative, ensuring that the pre-release services are covered and billed for up to 90 days prior to release. really promoting that continuity of care. And again, this unprecedented opportunity where folks like you can engage with youth prior to release to build that rapport. Many of us who've been doing this for a long time and doing reentry work for a long time, we know it doesn't work to give them a slip of paper and say you have an appointment at this federally qualified health center on this date. They really want to know who they're meeting with, and any work that can be done upfront in terms of screenings or assessments really helps to build that rapport. Also, making sure that appointments are timely when they're getting released, and ideally same day as release, and meeting, you know, their unique needs, and ensuring that there's communication with the justice agencies, and in this case, the probation agencies. So, Andy, the section 1115 you mentioned allows behavioral health care providers to bill for Medi-Cal services. Yep. While they're detained. Yep. That is going to be, that's a major part of this. So that the idea is, you know, there have been barriers in the past to getting people with smooth transitions of care. And we know part of that has been because providers in the community haven't been able to bill for those services. And so there are going to be services, including the screening assessment, that will be able to be billed under Medi-Cal. And so that is going to be a major shift. Next slide, please. So California plan, CMS, the federal government really loves the California Justice Involved 1115 demonstration. And they've cited this as an example for other states, and many other states are watching you guys to see how this plays out. So there is, you know, targeted scope of pre-release services that we talked about. And then really this idea of increasing collaborations with correctional authorities and working with probation agencies in your community to develop best practices for data sharing, care coordination, continuity of care, and engagement for this population. Next slide, please. And this is where I pass the baton to John.
Thank you, Julie. Yeah. Happy to take the baton and run with it from here. And again, I'll just encourage people to put questions as we go. So let's talk a little bit about creating a whole person approach to the health needs of juveniles in the justice setting. And again, recognizing that as we go a little bit broader, not everything here is going to be Medicaid eligible, as Julie was just talking about with the CalAIM and the 1115 waiver. But we want our youth to be successful. We mentioned earlier about needing to make sure that they are successful with their family. And so we are going to talk a little bit broader about the services and the needs of youth. Going back to the sequential intercept model. What might have been addressed to prevent the incarceration of youth? Julie, on her slide, highlighted that those the intercepts 4 and intercept 5, really the end of the incarceration. And if you think back to wishing that maybe somebody had put in mental health supports or family supports at that community level, at that intercept 0, you might not be working with this youth. They might be successful in school and in life, and you wouldn't be working with them later on. And so looking at this more as an opportunity for prevention and what might have been addressed to prevent the incarceration of youth. And so if you think about now where you are with this youth, living in the real world, you're at intercept 4, intercept 5 with these youth, maybe think of it as intercept 0 for their adulthood, right? That you're keeping them out of the adult system, that you are building services and supports to help prevent them from going into the adult system and to be able to be successful. So we'll talk a little bit about key issues. We'll talk about some of the best practices, and then we will also talk about how this might apply for you in your office and your work today. Next slide, please. So when we talk about the whole person approach to the health needs of juveniles in the justice setting, what specifically are we really talking about? What are some of these needs? So mental health supports comes obviously to the forefront. We know a lot of the youth are dealing with mental health issues within our facilities. We often hear the phrase that our jails are the largest mental health providers in counties and communities. And so unfortunately, we know mental health causes a lot of the incarceration of youth. and that they don't all get the support that they need. And if they had earlier in life, again, they may not be dealing with the incarceration now. LGBTQ plus related issues, youth having identity issues and youth feeling comfortable, youth having people in their lives that they could talk about what's happening with them, and building strong positive relationships and having strong positive role models for their lives is another issue that we feel that youth need to have addressed in their life. Education and training, Julie mentioned earlier, that youth who are incarcerated, what do they want more than anything? They either want to go back to school or they want to be able to go to work. And so the education and training, and you see the box right next to that that says employment. If a youth can come out of incarceration, get the proper training, get the proper education, have opportunity, they're much more likely to take that path than potentially ending up back in the adult system. Physical health, you're all aware of, you're all very used to working with the physical health of youth, but that's part of it, right? If they can't work, or if they can't be healthy, or if they're heading towards a life of diabetes or what have you, then from poor diet or not having proper exercise and not having their physical health needs met when they're young, they're certainly not going to have them met when they're older. Substance use, certainly, again, something that you're all very familiar with, contributes to incarceration and contributes to poor decisions. Again, something that if you're recognizing it in a child, if you're asking those screening questions, if you're seeing really the substance use in families that you know is pervasive and generational, that needs to be addressed with the youth while they are younger and while there's still the opportunity to address it before, again, it gets more serious, gets heavier drug use, and again impacts their whole lives. Racial and ethnic disproportionality, we know that there's disproportionate number of Black kids, of Black and brown kids in our facilities, that it is disproportionate for not just the amount of kids, but for the length of sentences. So being able to have services and support so that when kids are meeting with you, whether they're meeting with clinicians, where they're getting services, are they getting them from people who look like them or who they feel like understand them? So thinking about that as part of your approach. Housing supports, again, I know that you may feel like this is beyond the scope of work that you can always do, but if we're not connecting families that are housing unstable to the housing supports in their community, how can we expect them to get appropriate mental health supports? How can we expect them to go to school or to stay healthy if they are living in the car, if they are living in the woods, if they are sleeping on a sofa? So recognizing that housing supports are all part of keeping kids healthy and being able to have them successfully integrate back to the community. And family and community supports we talked about earlier, that not just the child themselves, the youth themselves, which I know often becomes the person that you are designated to work with, but if they can't be in a healthy family, if the family themselves can't get support for the trauma that they've had in their lives, then likely the youth is going to repeat some of the behaviors that caused them to be incarcerated. The impact of trauma, I think Julie said earlier, what was the statistic? 80% of the youth who are incarcerated have made comments that they have suffered a trauma in their life, a loss of a parent. Maybe it was them coming into foster care. It could have been any one of a number of traumas that truly impacted their ability to function. I used to do foster parent training, which I did is a little off to the side here, but foster parents would come in and they would sit down and they would always sit in the same seats. And at one point I would say to them, now I want you to get up and move and sit next to somebody you've never talked to before or different. And it was like a trauma to them to just in the classroom get up and move their chairs and not be able to sit next to their spouse. I'm like, this is such a small thing, and they were acting like a trauma. Imagine being taken from your house as a child, either through the child welfare system or being incarcerated, as Julie said earlier. Just the incarceration itself is a trauma. So thinking about the impact of trauma on a life and the ability to make decisions and to feel like you have opportunity in the future. Transportation is another part of making sure that the health needs of juveniles are met. If we set them up for mental health treatment, we set them up for education and training, but they can't get there because of transportation needs, then we've really just set them up to fail, right? So thinking about the transportation and the access to services, having quality services that aren't accessible really doesn't help them to have quality services. And then this last one, this concept of being a provider and a mentor. Really, you have a role in the life of these youth. You have a role in being able to show them that there are people that care about them, that support them, that can connect them to the resources that they need to be successful. So thinking about yourself, not just as somebody that is doing your job in connecting them and sending them on their way, but what is your role as a provider in a community? And even really being able to be a mentor or connecting youth to mentor is really an important role that many of you play in your communities and in your system. Next slide, please. I'm just going to emphasize this one. I mentioned earlier the racial and ethnic disproportionality. In 2020, cases involving racial and ethnic minority youth were 50% more likely to be referred to juvenile court of a delinquency offense than cases involving white youth. But the level of disproportionality varied by offense and point of contact within the juvenile justice system. So there were variations, but what we've seen across the board in California and across the country is this overrepresentation of minority youth in our system. And if we really want to be able to provide services and supports, we need to be able to develop those services that are going to speak to these youth and provide them with adequate sense of belonging and caring in their community. Next slide. So what are some of the best practices? What are some of the more tangible, the things that we could be doing as a provider entity or as a provider service to these youth? Transition planning, and I did note earlier from the earlier survey, 36% of the people who responded to the survey said that they work with individuals transitioning from incarceration. So if you think about the transition, if you think about a child who might have started now getting some of this treatment, whether it's through the 1115 waiver and they're getting treatment within the last 90 days of their incarceration. And what does that transition look like back to the community? How do we have the continuity of care? And even if they're not part of the 1115 waiver, that transition back to the community, Julie spent a good part of the early part of this presentation talking about community-based services and supports and transitioning from incarceration or transitioning to a new community. How do we have the information follow the youth? How do we not have the youth or the family repeating their story over and over or feeling like they're going back to square one every time that there's a transition? Part of that is cross-system collaborations. I mentioned earlier my background in child welfare, but I also oversaw Pennsylvania's juvenile justice system when I would speak to our youth, and sometimes I would speak to them as groups, and I would ask them how many of them had been involved in the child welfare system when they were younger. 2/3 to 3/4 of the youth would raise their hands that their family were involved in child welfare. So what are we doing to connect our juvenile justice work with some of the prevention efforts that are happening now across the country in child welfare? Or again, cross-system collaborations with county or state mental health systems, drug and alcohol treatment, housing, all these areas that I talked about earlier. What are the cross-system collaborations that you can help develop that will support good transition planning, good support for the youth and their whole family? Again, recognizing that the Medicaid system and providers can't provide all of these things, the collaborations are really going to be key for success for these youth. Having a trauma assessment, I know that there was some chat earlier, and I saw a link to a trauma assessment, so I won't spend a lot of time on that, but recognizing, again, 80% of our youth have identified that they've suffered a trauma that prior to their incarceration, and probably 100% of them were traumatized through the incarceration. Easy access to treatment, I mentioned that also earlier. How are the youth getting there? How do they have to take 3 buses to get to a mental health treatment center? Do they have supports to get there and get back? So access to treatment, that could be both the transportation, but also the wait lists, right? That if we're working to set youth up for treatment and supports, and then there's a long wait list or they can't access it immediately or what have you, then the youth isn't getting the support they need. So always thinking about not just quality, but also access to treatment. Information sharing, and certainly I know that there's barriers to information sharing, and we certainly want to support individual rights for maintaining their privacy, but with proper signing of release forms, with proper information sharing within guidelines and regulations. Again, these different collaborations, these different systems can work together to support the youth and their whole family. Restorative justice principles, really talking about not being punitive with youth and the stigma that youth receive once they've been incarcerated. And Julie mentioned earlier that youth records are not necessarily public records, but there's still some stigma to it. When we talk about, are you asking youth whether or not they've been involved in the juvenile justice system and are they comfortable responding to that? They'd be more responsive if they understand you were looking at this from a restorative justice model. How do we bring them back to the community and not just be punitive and judgmental for the youth? Mitigating effects of poverty. I think, again, you're all likely well educated in that. Everything we had talked about earlier, homelessness, food insecurity, with things that keep people from being physically healthy, not having transportation. These are all effects of poverty that might impact a youth and their family ability to be successful or to successfully access treatment. Whole family support, I have parentheses there, multi-generational services, that if you're trying to support a youth and then they're going back into a home or back into a community that caused them to end up to be in trouble to begin with, then we're not probably giving them the level of support we need. We know youth do better when their family does better, and families do better, frankly, when their youth will do better. We'd be lowering the trauma and the stress level in a home if we're able to talk to the family about whole family support. Leadership level planning for individuals, community, the whole population. If you're a part of a community system, if you're working within the community context, how are you working as leaders to build the collaborations within your community for the individuals you're serving, and really impacts the whole population? Julie earlier mentioned juvenile justice really is a public safety issue, right? So the whole community is safer when kids are safer and they're receiving the supports and services that they need. Motivational interviewing is, I know, a strategy that seems to be, it's an evidence-based practice. And I only hear good things when motivational interviewing with skilled staff who are really talking to the youth about what are the things that they want in life, what are the opportunities, what are the things that might motivate them to go to school, to get a job, to have positive relationships, and to build those motivations into the work that's happening with the youth. And cultural humility, serving youth within the context of the culture, just really, as we've mentioned a couple times, having youth feel like the staff that are working with them look like them, understand them, that their community, that they're getting services within the community and not really a stranger within their access points to services. Next slide, please. You know, I said all that, and I don't want to be all like pie in the sky, like there aren't challenges to do all this. Certainly there are. We want to be aspirational, and we also want to be realistic. So I feel like we can be both. We can achieve all the work that we've been talking about today, but also recognize that there are challenges. We know the human services system is really struggling with workforce challenges, and this is something that as a community-based organizations and supports, we have to work through. This is not easily solved, but assuring that we build up our workforce, that we support our workforce, that we give the workforce the supports that they need so that they aren't suffering through the secondary trauma of working with so many youth and families that are struggling are all important aspects. And thinking about yourselves as an agency, what are we doing to support the workforce that's working with these families? I mentioned access earlier, I mentioned family supports and home environment. The isolation of facilities is something we really haven't talked about. That a lot of these youth, when they're in facilities, my experience in Pennsylvania is a lot of the juvenile justice facilities are isolated. They're in the central part of the state. They're not near the big cities. And it's hard for the youth to both have family connections, to have family visits, but also to have a high level of services and supports, to have a lot of providers to support the youth in the facilities. And so we should be thinking about that in terms of your work. And are the facilities isolated, or are they able to have the access to the resources and supports that we're talking about today? Complex multi-system involvement. This isn't just a mental health crisis, or isn't just drug and alcohol crisis. Again, we've been talking over and over about the multi-system involvement and how we all need to come together around these families. Cost and funding is always a challenge. Defining adequacy. When do we say this is enough? And put some responsibility also on the family and the youth themselves is a challenge. Where do we stop the work and where do we transition ownership? I like to think that we start by providing intensive services and supports, but over time we are transitioning over ownership of the work to the youth and to the family, that they should be able to take ownership of this themselves as well. And just thinking about a system redesign, thinking about, are we doing things today the same as we did them 20 years ago? If we're doing things still today the way we did them 20 years ago, we're not probably serving these youth properly. It's a new world. These youth aren't, that we talked earlier about vocational training, and are they getting training and really the skills of the future, the computer and technology skills that they need, not just some of the vocational skills that are from the past. The other challenge I'll just add here is, I know fatigue. I know this is a lot of work. I know this is hard work. I know this is challenging work. But these youth really need us. These families really need us, and they really need us, these supports. So we have to take care of ourselves and avoid some of the fatigue of this work. So just This slide is really meant to show that there are challenges and recognize there are challenges. But if we can go to the next slide, we're also sitting here thinking, what are some of the things that we can do today? How do I leave this webinar and go back to my office and actually do things differently or make a change in the way we do our work? And so this slide is meant to share some of that with you, really thinking about the values that promote equity and well-being, and are all the decisions that you're making in your agency, or all the decisions that you're making as a provider, promoting equity and well-being of the youth we are serving. Are we maintaining an uplifting and safe environment for the youth that come in our buildings? And we'll talk about that a little bit more in a minute, but also for our staff. Are we developing staff to build positive and supportive relationships? So not just doing the checklist of the job, but really building relationships with the folks that we are working with. Providing varied and useful programming. Things are not typically one size fits all, even our evidence-based practices. Sometimes the work has to, we try one thing, and if it doesn't work, we try something else. Grounding our practice and culture in knowledge of adolescent development. Julie talked earlier about the brain development. It's frustrating working with adolescents sometimes, I know, but we have to recognize that their brains aren't really fully formed. And a lot of us would look back and say, oh, I don't get judged on all the decisions that I made when I was 16, 17, 18, and recognizing that their adolescent development is something that's influencing the outcomes for this youth and this family. We want to treat family members as partners. We want to encourage community connections. We want to incorporate continuous quality improvement in everything that we're doing. And so if when you leave here today, you're not able to look at these things and say, these are things that happen every day in my office, there's things that happen every day with my agency, there's opportunities here for you to start thinking, here, where can I start to build? Where can I go and do a little bit more and do something a little different? Next slide, please. So hearing all that, curious if you can take a moment, answer in the chat. What training do you need to address the needs of this population better? I think our partners on this call, the folks that sponsored this webinar, want to hear from you. What is it that you need to be successful? So I'll pause for a minute and see what training do you think that you need for this. You can either unmute yourself and speak, but probably easiest if you answer in the chat. So I don't see anything in the chat.
John, there's Andy said training on any mental health measures juvenile justice is using so we can know how to read and interpret. And then she also said training on accessing resources for youth that are transitioning. Andy, just for clarification, do you mean transitioning out of detention? Or are you talking? Yeah, okay. Okay.
Yeah, please, Julie, if you can help me. Even earlier when you were presenting, I wasn't seeing everything in the chat that I was seeing some of the chat, but
okay.
I didn't know if people were writing just to you versus to everybody.
Yeah. Okay, so we're taking this down so that we can go back and work out other training needs.
I do see one. The process that occurs when youth are released from jail would be helpful to know. Yeah, that's great. Thank you. Everything that you say here can sort of help us build whether it's future webinars or other trainings that you would receive. So Janet gave us a nice long list. At the local level, definitions, roles, responsibilities, list of facilities by type and current reentry process, contracted networks, referrals, how to make referrals, who, when, who, how, and when, care coordination, best practices, and transportation. I assume you're saying, what does that mean? How can we access transportation in our communities differently? And there's certainly some transportation options that we can talk about.
And part of you guys may not be familiar with this term, but California released what's called Path 3 funding for planning and implementation of these reentry services. And a large part of that work is this cross-stakeholder collaboration and definitely engaging with the managed care plans and also community-based providers to address these very things. And in fact, before county probation departments or county jails can go live with this package of Medi-Cal services, and before you guys can start billing, the state has to approve what's called a readiness assessment. And many of these things that you laid out here, Janet, are part of that readiness assessment. They really have to have clear process flows, clear policies and procedures, identified providers, you know, who's going to get what information when. Is it going to be via telehealth? Is it going to be, you know, if they're coming in and having an appointment? And it will vary from facility to facility and county by county, but these are really good points. And I think you're going to be hearing more about what that actually looks like as the counties start to engage in these, what we're calling path 3 activities.
Yeah, I mean, it's a little consultant speak, say the right, like we have to get on the balcony. Like you have to sometimes get back and see the big picture. And if you're only looking at just, we got a referral for a youth that they have this issue and we're going to connect them to this one entity. Sometimes getting on the balcony and seeing a bigger picture of what's happening in that youth's life and who the family connectivity are and what other struggles they have or what traumas they've been through might allow you to make a broader service plan or release referrals, you know, to other community services and supports that'll help strengthen that youth. Again, we don't want to set them up for failure by giving them a referral to a provider entity that they can't get to, or that the family won't support them going to. So why don't we go to the next slide? How can you better engage youth in their self-care? Any thoughts about that? And Julie, let me know if you see anything in the chat. I saw one out of the two before.
I don't see anything yet. But for you know, audience, you guys are probably doing this with youth in your practices already. So what are some of the things you help to promote? Oh, great. Janet added community health workers and peer support. Excellent.
Yeah. And I'll just jump in and then we can, unless somebody else, I'll pause for a second, but really, I'd almost ask the question, how can any of us be engaged in our self-care, right? Which would be talking to us in a way that we understand. You know, sometimes healthcare providers aren't always able to do that or help us see what's in it for us. You know, these youth think they're going to live forever, and these youth think that they are indestructible. So how do we help them see what's in it for them to take care of themselves and their health? Listen maybe somewhat to their fears and concerns. And I see Andy added, helping them get their basic needs met so that they have space to even think about what the self-care means and what steps they can take to be nurturing to themselves. That's right. And I see you put space there in parentheses, and I'm going to take that to mean, you know, I've seen a lot of studies when families are wondering where their next meal is going to come from, then they're not thinking what's going to happen next month, right? They're not going to thinking, how do I get a degree, you know, 2 years from now? They're wondering about how they're going to get their next meal or how they're going to pay their rent tomorrow, that you've got these crises hanging over your head. Where am I going to sleep tonight? It's impossible to be thinking about long-term. Self-care, exercising in the mornings, and basic diet and wellness education. And Andy wrote, absolutely help them move out of survival mode and teach them and coach them about self-care. And giving them a sense of a positive future and opportunity. Again, without that sense of positive future and opportunity, it's hard to convince them that they should leave your office or leave the provider's office and not do something that would be more of like that immediate gratification. And again, back to recognizing that their brains aren't fully developed. So I think we can go to the next slide. Yep. We can move on. How to engage justice-involved youth. And so thinking about this and what can you do to engage youth? So inviting teens to help make your clinic or practice teen-friendly. And we'll talk maybe in a minute about what that might look like. But instead of you saying, well, this is what it would look like for me, my teens were back in like the 1980s, right? So for something that to me in my mind might feel teen friendly isn't going to be the same maybe as what today's teens are. And ensuring that teens are fully engaged in their own self-care. And again, what does that mean to me is talking to them in a way that they would understand. And the motivational interviewing is really, those techniques can be pulled out at any time. And those techniques just around asking what do they look forward to? What do they see as important in their life? Who are the important connections and why in their lives? And how do they get them to understand keeping those connections and participating in their self-care and communicating about what their needs are really important. Just on the slides here again, invite teens to make your clinic or practice teen friendly. And you could do that with a local youth council. It doesn't only have to be with kids coming right out of carceral settings, that you could maybe work with some local youth and ask them to help stage a makeover to make your office and services more welcome to teenagers. And ensuring that the teens are fully engaged in their self-care. Train your entire staff on how to foster that open communication and trust with the teens you are serving so that young people feel comfortable talking about their health and wellness. Be sure that staff are up to date on policies for protecting privacy and confidentiality. And then I think that's something you would always want to say to the youth, right? Like, hey, before we have this conversation, I want you to know that this right now is just between you and I. Without your permission, it won't be shared. Next slide. So it's not just youth, it's not just the family. When you think about schools and the community, and we haven't really touched on school at all, we've talked about employment and education, but involving student leadership councils or other groups of students to implement school-wide youth-led programs to take a strength-based approach to promoting adolescent health and mental health. If you think about prevention work, but schools are such a key part in the community work that you would try to do if you're trying to build community connections. And frankly, I've spoken to enough school superintendents and principals. They think they are also doing everything and everything is on them. That they think they are mental health providers, that they think that they are counselors, that they think that they are working with homelessness and they are working with food insecurity. And I know school leaders in your communities would be welcoming to partnerships around youth mental health and around how do we support the kids that are coming in and out of their building and then also in and out of your facilities. So if you haven't thought yet about maybe in your community engaging schools as part of this whole discussion, please do. Please start thinking about that as well. And think of them as a resource and a partner. This is where the kids spend a good part of their day, the youth that you are trying to help support and you are trying to help develop and grow. Next slide, please. So another opportunity for us to connect with you. So what's the first thing you should see when they walk into a provider's office? So don't spend too much time necessarily looking at the picture, and this was not meant to be an example. But we talked earlier about maybe having some teenagers come in and give you some advice, but whether you think about it yourself, or maybe you have your own children and you would think about what I want them to see walking into an office. What should you see when they walk into a provider's office? Think of a not trusting youth. Think of a youth who doesn't want to be there, is being there because somebody told them they needed to be there. Or maybe a youth who's really looking for help, but doesn't really have experience or words, to express how they're feeling. What would you want a youth to see walking into your office that might open up that first opportunity for them to have a conversation, for them to have a little bit of trust? Any ideas? Well, sometimes it could be one of a couple of ways to manage it, but I think the youth would want some direction of what do they do. So whether that's a person, whether it's a person, some places I know just have kiosks, but if you were, again, picturing yourself as a youth, not sure what to do, you'd be saying, I'd like to speak to a human, right? I see Andy wrote in materials in the family's native language so that the youth don't have to translate. Absolutely. Or that the youth, again, maybe they wrestle with English a little bit and they could be more communicative, or even just seeing things in their native language might make them feel, oh, there's other people that come into this building that look and sound like me. Andy wrote more. I've had youth let me know that they don't like having to translate and function as go-betweens. Yep. So whether it's translating for the parents or siblings or I guess any one of those scenarios. And again, if you think of the youth themselves wanting to be able to communicate and build trust, not feeling like anybody in that building look and sounds like you would really be a detriment to being able to have a positive, open, trusting communication. Anything else come to mind for folks about the office? You know, there's some obvious ones about it being clean, right? And about having space, and the youth feeling like if they want to go sit by themselves on their first time and not be in a big crowded area, then that's probably good too. I know there might be some physical limitations that everybody deals with, but if you think about that youth, again, think about everything that you've heard today and think about the trauma of the youth, and then think about them coming into your office or your facility or provider, you know, somebody that I know you all have different roles, so somebody that you're funding or supporting. And is that youth going to walk in and that first impression, is that going to build trust? Is that going to build collaboration? Is that going to build the opportunity for the youth to talk about their experiences, or is it going to shut some of that down?
And John, maybe even something as simple as artwork that speaks to youth, or artwork produced by the youth. A lot of times, I've worked in carceral settings for almost 30 years, and amazed by the talent that I've seen with both the youth and adults that I've worked with. And so maybe promoting, framing some of their artwork and, just bringing their lens and their view into that office, make sure there's comfortable seating and maybe posters that can engage them, magazines that are age appropriate, that type of thing.
Yep, some bright colors. Again, I'm looking at this office and it's sort of, again, it's reminding me of maybe older, dingy, and really sort of, again, we want to be welcoming, and there's certainly some whether it's the colorful art or chairs or something that you've all walked into places where you felt are welcoming, and you've all walked into places that you feel like, yeah, I'll be glad when this is over because I don't really want to be here anymore. And a lot of these youth are walking in already feeling that before they walk in. So if there's little things that you could do if you walk around your building and you walk around your office that say, and the truth is these things that we're talking about translating from youth likely would translate to adults and other families as well. Okay, I think we have one more slide before we start moving towards the wrap up. And we did want to say that this can happen. And, again, we want to be aspirational and realistic. We didn't want to present a whole lot of things that you would say, well, this is lovely to hear, but it would never happen in my community. So this can happen. There are action steps that you can take. First one we have here is get engaged in already existing convenings or standing meetings where key relationships can be strengthened and information can be shared. There are community collaborations that happen in every community. There are public, the local county or state government always has to have public hearings on the things that they are doing their budget. They are sure relationships in your community with mental health providers, drug and alcohol treatment providers, schools, as we mentioned earlier, that hold events and public. So be part of the community, and you don't have to sit and call everybody yourself to your office. You can get engaged in already existing convenings or work groups or standing meetings where you can build relationships. Develop a clear communication strategy. Communication strategies include what are your key messages and who do we need to deliver the message to, and who delivers the message, and what format is this? Electronic, emails, posters, timeline. Who's going to, let's start now, or do we need a 6-month communication plan strategy? But Let your community know, let your members know, let the people who are receiving your services know that you are caring about their whole family, that you are caring about their community connections, you are caring about the trauma that they've been through in their life, and not only just trying to, again, do the minimum that you need to do. Determine who are the conveners of partnerships and key community-based organizations in the community and connect and share opportunities. So maybe it's local legislators. Go into the local legislator office, and they often have community breakfasts and things like that. So see who are the conveners if you don't find something in your community, and say, we want to be part of that. We want to be part of the community positive outcomes for the youth that we're serving. And again, these youth coming out of these incarceration, they need opportunity, they need help, they need to know that there's positive outcomes for them in the future with the right support. And then just building the internal infrastructure, proper information, having those release forms that I mentioned. To be able to do information sharing, you need the release forms, you need the staff capacity, you need to have the proper workflows, the bureaucracy. And I've spent most of my entire career in government, so I know bureaucracy. So I'm maybe more saying this about myself than any of you, but boy, when you can minimize that bureaucracy, when you can improve access and help people flow through the system easier, then a lot of positive things can happen. So looking at your own internal structure and say, are we building pathways or are we building barriers to service for the people that we are trying to connect to? And the next slide is really a wrap up. So some key takeaways that we wanted to share is that justice-involved youth have unique healthcare needs. The CalAIM demonstrations offer the opportunity to address those unique needs and positively impact transitions of care back to the community. And the CalAIM demonstrations supports the creation and implementation of a whole person approach to meeting the healthcare needs of justice-involved youth. And those are just a couple of bullet points, that we wanted to share. We hope you had a lot more takeaways and that these are just really the big buckets of takeaways. But really, California has a great opportunity with this 1115 waiver, but also just being able to say, we care about these youth. There's things that we can do with the technical implementation, but there's also more than that, being able to show that you care and support and being able to change lives. So with that, Julie, I'll ask you if you have any other words of wisdom or key takeaways, and otherwise we will just see what questions there are.
I think you covered it, John. You did a great job, and just want to thank everybody for hanging in and participating. Now we have an opportunity to answer questions, and you can either, again, come off of mute or put your questions in chat, and we'll hang in there until we answer everybody's questions. John and I both trained as therapists, so we can sit with silence for a while. So we won't let this go on too long, but really encourage, if you have anything that you felt like wasn't answered or we could get information or get back to you with, please let us know. Nancy, thank you so much for the information. Thank you, Nancy. Thanks for joining and allowing us to be part of this this training today. No questions.
So with that, I guess we can. Yep. I don't know if Mary Ellen, you would close us out since you opened us.
Absolutely. Thank you all for your participation today. We greatly appreciate it. As I stated in the beginning, we will be sending the slide deck for today's webinar, as well as the webinar recording at a future date. So thank you so much again today.
All right, everybody. Thank you. Have a good afternoon and evening.